Then we're going to look at how exercise can be used to address some of these issues experienced by cancer survivors. This is a study in breast cancer survivors where they were using aerobic exercise training or resistance exercise compared to just usual medical care in early stage breast cancer patients who were on chemotherapy. And even during chemotherapy, they adhered to the program at a rate about 70%, so they showed up to 70% of the sessions, which is not too bad. They experienced changes from pre to post program in terms of improved quality of life. We can see this happen in both the resistance exercise group in red and the aerobic exercise group in blue. Changes in aerobic fitness, well, we can see the aerobic exercise group was the only group that improved aerobic fitness. The resistance exercise group had a significant reduction in fitness, as did the usual care control group. Muscular strength, well, this improved in the resistance exercise group, as you would expect, and not so much in the other groups. And changes in body fat, well, while the resistance training and aerobic training didn't make them leaner, they certainly avoided putting on body fat that was experienced in the usual care group. And what they discovered when they looked at the different barriers to people showing up to their sessions, they had three major themes. First of all, there was the disease and treatment related barriers. So they were experiencing acute side effects as a result of their treatment, chemotherapy treatment, or they were going through the treatment itself, and that clashed with the session. And interestingly, this accounted for 53% of the missed sessions, of the sessions that the women missed. Next was life-related barriers, such as work issues, childcare issues, transport, vacation. And you can imagine if you're going through cancer treatment at the same time as trying to deal with work and raising the family, that things are going to get busy. And these accounted for the next highest rate of life-related barriers for attending the session, 34%. Motivation-related barriers in terms of lack of time, lost interest, forgetting, accounted for 13% of all missed sessions. So motivation to exercise, even during chemotherapy, isn't the issue here. The disease and treatment side effects and life-related issues certainly can be barriers, but these women do want to show up for the exercise session. So motivation isn't the issue. And obviously those who missed more sessions tend to report more barriers. Then we're going to look at prostate cancer. And I mentioned before about hormone therapy and how it affects different areas. This is just a quick diagram of how androgen deprivation therapy, which is basically reducing the body's testosterone levels down to zero, how this affects men with prostate cancer. Affects their balance, physical capacity. They lose muscle mass, so that means they lose muscle strength. They tend to put on adipose tissue, particularly central adipose tissue, so they end up with metabolic syndrome, diabetes and cardiovascular risk factors, and they also lose bone, which is another big part of hormone therapy. So this study looked at changes in muscle fat and bone mass after 36 weeks of androgen blockade. So this is treatment for prostate cancer. And what we can see here is skeletal muscle mass. This is appendicular skeletal mass. Muscle decreased by almost 5 kilos, 5% on average. Whole body fat mass and particularly trunk fat mass increased by 13 and 12% respectively. So they're losing muscle and they're gaining fat, and most of this fat is occurring around the trunk, precisely where it becomes a big problem for cardiovascular risk and type 2 diabetes. They also looked at changes in bone mineral density, and we can see a loss of, in 9 months, a loss of nearly 4% of the bone density in their lumbar spine, which is significant. Loss in the hip and in the upper limb as well. So when we get this in perspective, if we look at people on androgen deprivation therapy, this is men, non-metastatic prostate cancer, per year they can lose up to 4.6% of their bone mass. Compare this to menopausal women, postmenopausal women, who traditionally the people that are targeted for, increasing their calcium, vitamin D supplementation, getting exercise to avoid hip fractures. They lose 1% a year. These men are losing 4 times that amount. And this is a study looking at how muscle strength and function is affected, and we see impaired physical function and balance and reduced upper and lower body muscle strength. So this affects their walking as well as other functions of daily living. So this affects their physical reserve capacity, and it's certainly a worry for these men as they age. So if we are to plot musculoskeletal fitness with age on the x-axis, normal aging, we improve our fitness up until our early to mid-20s, then muscular fitness and strength power reduce, and if we are not sufficiently active, then we get to a point where our musculoskeletal fitness is not sufficient to keep us independent anymore, and we become essentially dependent or disabled. ADT, or androgen deprivation therapy, will accelerate this decline in muscular fitness and reduce the age at which they might become dependent or disabled. Resistance training aims to counter that by improving muscular fitness and slowing the decline with age, hopefully to the point where you die of something else before you become physically disabled or dependent on care or other ergogenic aids. So one of the issues with prostate cancer for men is the development of metabolic syndrome. You're on this long-term hormone therapy, and eventually you're going to accumulate risk factors that become metabolic syndrome. So metabolic syndrome, generally in this case, they defined it if 3 of the 5 conditions of abdominal obesity, high glucose, high triglycerides, low LDL, hypertension. And we can see that those with ADT, represented in dark blue on the graph, a significantly higher proportion of these men have metabolic syndrome when compared to either age-matched men, labelled control, or those with prostate cancer who aren't on ADT, in the white there. And so in observational studies where we've looked at men diagnosed with local prostate cancer, we see that almost half of them developed diabetes, quite a large proportion develop either coronary artery disease or have a myocardial infarction, and quite a lot experience sudden death. So cardiometabolic risk is one of these big issues for prostate cancer survivors in particular, and most of these men will die of heart disease or diabetes or its complications before they will die of prostate cancer. This is another study that looked at men undergoing radiation therapy, and they were looking at 3 times a week aerobic training in a home setting for 12 weeks, and the primary endpoint here was fatigue. So again, this big issue: can exercise address one of the biggest issues associated with the treatments of cancer, which is fatigue? The main result is they found that the control group had increased fatigue, and the exercise group had improved walking distance. If we have a look at their fatigue results, the graph above is plotting the time course of fatigue for the people in the control group. And we can see that at baseline, their fatigue went up until the end of radiotherapy. And then even after the end of radiation therapy, their fatigue levels dropped, but they still remained above where they were at baseline. If we look at the bottom chart there, this is the exercise group. They also got an increase in fatigue, but it was much more blunted. It wasn't this great big increase in fatigue that the non-exercise group experienced. And they actually recovered their fatigue levels to actually better than baseline levels. So we can see, this is where they ended up compared to where they started, and those who exercise ended up essentially better off than they were at baseline. So I think, and certainly this study demonstrates that if we exercise someone during their treatment, this is during radiation therapy, that the fatigue side effects are certainly going to be reduced or minimized. This is a study that looked at using resistance training and aerobic training in men with prostate cancer. A quarter of them were undergoing radiation therapy, but all of them were undergoing androgen deprivation, or this testosterone reducing therapy. And what they found was in multiple domains in terms of muscle mass, muscle strength, aerobic capacity, balance, and quality of life, and C-reactive protein, which is an inflammatory marker indicating cardiovascular risk, is that the exercise group significantly outperformed the control group. So across multiple health domains, including fatigue, exercise is able to improve prostate cancer survivors compared to those who don't undergo exercise.